Which of the following is true with respect to carditis caused by Lyme disease? Patients most commonly experience initial symptoms several years after the initial tick bite. B. Patients most commonly present with variable degrees of atrioventricular AV block. C. Patients most commonly suffer from symptoms of CHF. D. The prognosis of patients with Lyme carditis is poor, as almost one-third of patients ultimately require a heart transplant. E. Most patients are seronegative for anti-Borrelia antibodies at the time of presentation. B. Patients most commonly present with variable degrees of atrioventricular AV block. Carditis complicates approximately 5% of untreated patients with Lyme disease and more commonly affects men. Cardiac manifestations occur during the early phase of the illness, typically within a few weeks to a few months of infection. The most common manifestation is AV block of varying degrees. Patients with a PR interval 300 milliseconds are at highest risk for progressing to complete heart block. Occasionally, patients require permanent or temporary pacemakers. However, most patients recover quickly without sequelae within 1 to a few weeks. Occasionally, patients have persistent first-degree heart block. Patients less commonly suffer from myopericarditis and symptoms of CHF. When present, myopericarditis is typically asymptomatic and not clinically relevant. Overall, the prognosis for patients with Lyme carditis is very good. The diagnosis is made when patients with appropriate findings give a history of tick exposure or have positive antibody tests. While patients with early localized Lyme disease can have false negative antibody, most patients with Lyme carditis are seropositive.